Hi guys, today we're going to talk about the Zika virus, what it is, why you should know what it is, and what you can do to prevent it. Basically, this virus is something that's been around for a long time, but what happened recently is that it started spreading in Brazil in May of last year in 2015. It can cause abnormal development or birth defects in babies. So that's what happened. They had this huge outbreak of women giving birth to babies with very small heads, meaning that the brain didn't develop correctly. That's what caused all this concern over the Zika virus. There's been a larger spread of the Zika virus lately. So how do people get it? People can get it by being bit by a mosquito who carries the virus. So a mosquito will bite someone with the infection, and then they become carriers of the virus, and then they go bite someone else and give it to them. So that's the way that it's spread through a mosquito bite. You don't really get it by touching someone who has the infection or by respiratory droplets. If someone coughs on you who has the infection, that's not how you get it. You get it through a mosquito bite. It's also been reported sexually transmitted or through blood transfusions. And it's been reported, of course, the pregnant mother to the child that they're carrying. Also at the time of delivery, vaginal delivery. For women who are breastfeeding, it actually has not been reported transmission through breast milk. So the CDC up to today still recommend that mothers who are breastfeeding, even though they have the virus, they can still continue to breastfeed. After someone gets infected by the virus, it takes 3 to 12 days to develop symptoms. Only 1 out of 5 people who have the virus will have symptoms, and the symptoms tend to be very mild. They're very vague symptoms too, like a headache or muscle pain, joint pain, a fever, red eyes, headache, and death is very rare, but really the concern is that pregnant women can give it to their babies, and the babies are born with these born defects. That's the worst thing. So as of now, there's really no treatment for the Zika virus infection or vaccine. Once someone has the infection, it's just supportive treatment, meaning IV fluids, or if they're having a fever, Tylenol, or just pain medication. If they have pain, just supportive treatment to make them more comfortable. If someone is pregnant, you want to get ultrasounds every 3 to 4 weeks to try to catch if there's any symptoms of the baby having it. How do we prevent from getting this infection? Well, first of all, don't travel to areas where they're having a huge outbreak right now, like Brazil or South America or Central America, even Mexico. And there's been a few cases here in the US, like I think like 4 or 5 cases in Texas and California and Hawaii. If you did travel, go see your doctor, especially if you're having symptoms, especially if you're a female and you're pregnant. If you're planning on getting pregnant, go see your doctor before. Another way to prevent it is if you have to travel or you live in one of these locations where there's an outbreak, then definitely use insect repellent. Wear long sleeves, be in air-conditioned areas. You can use those mosquito nets. It's safe to use those bug sprays when you're pregnant, as long as it's just with permethrin or DEET, it's called. So make sure that the label says that it's just those two. Since it's transmitted through the mosquito, well, you want to get rid of any areas where mosquitoes can breathe. All right, you guys, so I hope this gives you a lot of information. Like the video, subscribe to our channel, send me any questions to GynoGal@gmail.com, and like us on Facebook, and I'll see you next week. So up on top, it has the days of the week, so it'll say Sunday, Monday, Tuesday, Wednesday, Thursday, etc. And you can follow it that way. The Western is another very common one. And then the ring looks like this. Squeeze it, it goes in the vagina. And then the patch is a little sticker, it's a little square sticker, maybe like 1 inch.